Good afternoon, everyone, and thank you to the ARNNL for the invitation to participate in this webinar series and for the interest expressed in this topic. Just some information I'd like to share with you as part of this presentation. I just want you to be aware that CADTH is funded by federal, provincial, and territorial ministries of health and charges fees for 3 of the programs that it oversees: the Common Drug Review, the Pan-Canadian Oncology Drug Review, and the Scientific Advice Program. In terms of my personal disclosure, I am a CADTH employee independently based in Newfoundland, and I have no conflicts to declare in relation to this presentation. I'd like to thank the following individuals who contributed to this presentation: Cindy Mosier of the Canadian Institute for Health Information for providing data on the context of pressure ulcers in the Newfoundland and Labrador healthcare environment and in other Canadian health jurisdictions, and Brenda Lynn Enns and Ann Tucker for their feedback on this presentation throughout its various stages of development. So this presentation will focus on a review of the evidence pertaining to newer and emerging technologies to prevent and manage pressure ulcers based upon a selection of critical appraisals published in Canada in the last 5 years. As we go through the presentation, here are some questions you may wish to reflect on in terms of your own nursing practice and the evidence and other information you currently use in your clinical decisions. Just a quick bit of background about CADTH. CADTH, as previously mentioned, stands for the Canadian Agency for Drugs and Technologies in Health, which is a producer and broker of evidence-based reviews on health technologies which are used or being considered for adoption in the publicly funded health systems of Canada. CADTH analyzes the evidence on healthcare devices, drugs, vaccines, medical interventions, surgical interventions, laboratory tests, and dental procedures. In addition to providing evidence, CADTH also provides recommendations, advice, and implementation support for the incorporation of evidence into various aspects of healthcare policy and clinical practice. In addition to the aforementioned CADTH programs, CADTH also operates a health technology assessment program, an optimal use program, a rapid response service, and a horizon scanning program. These programs and services are designed to meet different decision-making needs and are intended to evaluate health technologies across the life cycle, from the development phase through to managed introduction, appropriate use, and managed exit when the technology becomes obsolete. So pressure ulcers, as you know, are caused by continued compression of the skin by the weight of an individual. This impairs blood circulation, which in turn damages the skin's integrity, resulting in a chronic wound. Pressure ulcers are most common among individuals who are immobile and prone to spending extended periods of time in the same position. The prevalence of pressure ulcers in Canada ranges between just over 25% in acute care hospitals and just under 30% in long-term care facilities. And pressure ulcers have serious implications for quality of life of patients and residents, as well as serious financial impacts for the healthcare system. These next few slides are provided courtesy of the Canadian Institute for Health Information, or CADTH, and are derived from the public section of CADTH's website at yourhealthsystem.cadth.ca. The data is updated annually by CADTH, and if you'd like more information about CADTH and its resources, please contact Cindy Mosier, CADTH's Manager of Client Services for Newfoundland and Labrador and PEI. So this indicator that we're looking at now on the slide, worsened pressure ulcer in long-term care, this examines the percentage of residents whose stage 2 to 4 pressure ulcer had worsened since the previous assessment. It's calculated by dividing the number of residents whose stage 2 to 4 pressure ulcer worsened by the number of all residents with valid assessments, excluding those who maintain a stage 4 ulcer within the applicable time period. In terms of interpretation, lower is better. It means that a lower percentage of residents had a stage 2 to 4 pressure ulcer that worsened. And these are the results broken down by region in Newfoundland and Labrador. Using national comparators, Newfoundland and Labrador at 1.7% performs better than the national average of 2.9%. And as you can see, there is variation in results across the province. Central is on the lower end, 0.9%, Western 2.1%, and this is based upon 2015-2016 data. And this type of information, as you can imagine, can be helpful in terms of identifying which areas of the province and the country in general seem to be managing well on a particular indicator. And certainly from the perspective of mentorship or sharing best practices, this can be useful information for regions to support one another and share information about what, where they're doing well in particular areas of healthcare. So from a national perspective, as you can see from this slide, Newfoundland and Labrador performs very well on this measure compared to other provinces across the country who collect and report long-term care data and submit this to CADTH. Other provinces could certainly benefit from learning about the practices in Newfoundland and Labrador, and so again, this information, this kind of rolled up at a national level, can help jurisdictions to share information about best practices. In 2016, the Canadian Patient Safety Institute and the Canadian Institute for Health Information produced the guidance document Hospital Harm Improvement Resource on Pressure Ulcers. And the aim of this document is to link measurement and improvement by providing evidence-informed resources that will support patient safety and improvement efforts. The goal is to reduce the incidence of pressure ulcers. And based on 2011 recommendations from the Institute for Healthcare Improvement, the following key changes for improvement were noted for preventing pressure ulcers: conducting a pressure ulcer admission assessment for all patients, reassessing risk daily, inspecting skin daily, managing moisture on the skin, minimizing pressure, friction, and shear, and optimizing nutrition and hydration. This document also highlights a number of emerging therapies for the prevention of pressure ulcers, notably microclimate control, prophylactic dressings, fabrics and textiles, and electrical stimulation of the muscles. And in the following slides, I'll discuss some recent evidence reviews which have been conducted on these interventions. In 2016, CADTH undertook a review of emerging technologies for the prevention of pressure ulcers in patients in acute care settings. The purpose of this report is to examine the clinical effectiveness, cost-effectiveness, and evidence-based guidelines regarding the preventative use of emerging technologies in adult patients at risk of developing pressure ulcers in acute care settings. While the evidence found was limited, there is some useful information contained in the report which may assist decisions related to these technologies. And in the next few slides, I'll discuss these in greater detail. So as you know, there are a number of established interventions which are currently being used to prevent the development of pressure ulcers in at-risk patients, and these established interventions were included in the scope of this review. In terms of the new and emerging interventions, microclimate control techniques, prophylactic dressings, silk or silk-like fabrics, electrical muscle stimulation, and decision support systems were the new and emerging technologies assessed in the review. In terms of findings, there was one finding related to prophylactic polyurethane dressings. In terms of some of the studies reviewed, one study reported no change in gluteal thickness or pressure distribution. One randomized control trial compared polyurethane film dressings with hydrochloride dressings. And in this study, the incidence of pressure ulcers was lower in the patient group using the polyurethane film dressings. There were fewer overall dressing changes in the patients using polyurethane film dressings. And the total number of dressings during the study period was lower in the patients using the polyurethane film dressings. So the study concluded that polyurethane film dressings performed better and were more effective in preventing the development of pressure ulcers in the acute care setting. No published literature was identified related to the cost effectiveness of emerging technologies for the prevention of pressure ulcers in acute care settings, or regarding the clinical effectiveness of emerging preventative strategies in the operating room. Evidence-based guidelines from the National Pressure Ulcer Advisory Panel in the United States, the European Pressure Ulcer Advisory Panel, and the Pan-Pacific Injury Alliance contain a number of recommendations pertaining to the use of emerging technologies for the prevention of pressure ulcers in acute care settings. The recommended practices include microclimate manipulation, prophylactic dressings, silk-like fabrics to reduce shear and friction, and electrical stimulation of the muscles in individuals with spinal cord injury. Overall, these recommendations were made based upon indirect evidence and/or expert opinion, with few recommendations supported by direct scientific evidence from properly designed and implemented clinical studies. The majority of the recommendations received a weak positive recommendation grade as determined through a formal consensus process. As previously noted, CADTH has a horizon scanning program which is intended to provide early evidence on technologies which are new and emerging in Canadian health systems. In 2015, CADTH assessed the early evidence on a device designed to promote movement through intermittent electrical stimulation to prevent pressure ulcers. The device is called Smart E-Pants, and these are a specialized type of underwear for people at risk of pressure ulcers. The device delivers electrical pulses to areas of the body where pressure ulcers often occur, and this is meant to mimic regular body movements. Various styles of the Smart E-Pants undergarments have been developed, including modified designs for incontinent patients. They are intended for use by patients in all healthcare settings, acute care, rehabilitation, or long-term care facilities, as well as at home. The pants are meant to be used in addition to standard care practices. So the CADTH review noted that available studies of these devices were short-term, non-randomized studies of small numbers of patients. They measured pressure relief and patient-provider acceptance. The CADTH review concluded that the evidence on the Smart E-Pants technology indicates that it can reduce surface pressure and improve tissue oxygenation. However, the effectiveness of the device in preventing pressure ulcers had not been demonstrated in longer-term randomized control trials. So research on this device is ongoing, and researchers at the universities of Calgary and Alberta were reported to be planning a study to assess the potential cost savings of the technology. And those studies are ongoing right now and funded by the Canadian Institutes for Health Information. The 2015 CADTH review also noted that there were no adverse events reported in the small number of patients who used the Smart E-Pants undergarments. In terms of implementation issues, the early review noted that additional staff time is required to help patients position and remove the Smart E-Pants. This may be a consideration for healthcare facilities. Published estimates of the potential cost for these devices range from 500 to 2,000 Canadian, and the main cost is in the simulator pack. Once the electrodes are removed, the underwear are washable and reusable and may cost about $70 Canadian. And because these devices have not been approved yet for sale in Canada, we just have cost estimates at this point. But the manufacturer is attempting to obtain Health Canada approval to begin marketing these devices in Canada. So repositioning is the most widely agreed on intervention in the prevention of pressure ulcers. Patient lifts and transfer equipment are designed to allow patients with decreased mobility to be repositioned regularly. In 2013, CADTH published a summary with a critical appraisal of the clinical and cost-effectiveness evidence and evidence-based guidelines on the use of patient lifts and transfer equipment for preventing pressure ulcers. The patient population in this review were patients in intensive care. In terms of findings, no evidence was found pertaining to the clinical effectiveness or cost effectiveness of patient lifts and transfer equipment for the prevention of pressure ulcers. The guidelines identified did not address in their recommendations the use of these turning devices for the prevention of pressure ulcers, and information on interventions other than turning devices, such as turning regimes and multidisciplinary teams, was found, and it was noted that this could be potentially useful for decision making. In terms of treatment interventions, in 2013, CADTH published a review of the clinical, cost-effectiveness, and evidence-based guidelines on commonly used dressing materials for the treatment of stage 3 and stage 4 pressure ulcers in seniors restricted to beds in long-term care facilities. The review noted that selection of the right dressing depends on wound-related factors such as the presence of heavy exudate, necrotic tissue, and state of dryness of the wound and infecting pathogens. The location of the pressure ulcer wound and the presence of a comorbidity, such as incontinence, could also influence the choice of dressing. And while differing wound and patient conditions may favor choosing one dressing over another, the review itself found no evidence in clinical trials to recommend one type of dressing over another. It was noted that in the general population, radiant heat dressings may result in faster healing times in stage 3 and 4 pressure ulcers. One limitation in the CADTH review that should be noted is that 2 health technology assessments and 1 systematic review included in the CADTH study were broad in scope and without a special focus on seniors with stage 3 and stage 4 pressure ulcers confined to beds in long-term care. So it was difficult to determine the applicability of the evidence presented in those larger reviews to that particular resident group. The final report I'd like to highlight is a 2012 CADTH Rapid Response Report. This was a summary of the evidence with critical appraisal of negative pressure wound therapy for patients with diabetic foot ulcers and pressure ulcers. Negative pressure wound therapy is also known as vacuum-assisted wound closure therapy, topical negative pressure therapy, or vacuum compression therapy, and is promoted for use on wounds including pressure ulcers. It can be delivered continuously or intermittently. CADTH's review evaluated the evidence of clinical effectiveness of new machines for negative pressure wound therapy at different pressures for the treatment of pressure ulcers or diabetic foot ulcers. The review found a lack of evidence on the comparative clinical effectiveness of negative pressure wound therapy at different pressures and a lack of evidence on the comparative clinical effectiveness of continuous versus intermittent negative pressure wound therapy. Other more recent reviews have similar findings. For example, a 2015 Cochrane review concluded that, quote, there is currently no rigorous randomized control evidence available regarding the effects of negative pressure wound therapy compared with alternatives for the treatment of pressure ulcers. A high uncertainty remains about the potential benefits or harms, or both, of using this treatment for pressure ulcer management. And CADTH is continuing its work in this area. There is currently a project underway. It's a summary of the evidence with a critical appraisal on the clinical and cost effectiveness of polyurethane foam dressings for the prevention of pressure ulcers in adults in any setting. The review will also include evidence-based guidelines as well as a review of the evidence on safety and harms. If you're interested in finding out more about this project, I would encourage you to subscribe to receive new at CADTH, and this is our monthly e-bulletin, which contains all new published reports from CADTH, as well as various clinical practice tools that the organization produces and other resources that are available, including free education sessions and webinars. And there are other wound care topics that CADTH has addressed, most notably a recent series of reviews on diabetic foot ulcers. And these include prevention and treatment of diabetic foot ulcers, screening and risk stratification for the prevention of diabetic foot ulcers, and treatments for diabetic foot ulcers, or summary of evidence-based guidelines. And these reviews and related tools are freely available and downloaded from CADTH's website at www.cadth.ca. And this is a selected list of existing CADTH evidence reviews on various topics in wound care. All of the titles are hyperlinked to the related report on CADTH's website. And so this document is best used in its electronic format. The handout is not posted on CADTH's website, so if you're interested in receiving this, please feel free to email your request to me at sheilat@cadth.ca. That's SHEILAT@CADTH.ca. And if you are faced with a health technology acquisition decision, this implementation support tool may be of interest to you. It was developed by CADTH staff and Dr. Don Joswishin of the School of Public Health at the University of Alberta to assist healthcare decision makers with evaluating their acquisition decisions. 13 considerations for making an evidence-informed decision is a list of questions you can use to determine the efficacy of your acquisition decisions. And the tool includes practical questions such as, is this a want versus a validated need? Is there enough quality evidence to support a business case? Have you considered all direct and indirect costs associated with implementation? What is your proposed implementation plan? And has an evaluation of practical human factor usability been established for consistent and easy usage of the technology? This tool is not currently posted on CADTH's website, so please email me if you'd like a copy. And if you are considering a change in policy and/or practice, CADTH may be able to assist you. The Knowledge Mobilization and Liaison Officer Program is CADTH's outreach program for participating health jurisdictions, and our role involves working with healthcare decision makers at all levels of healthcare to identify and respond to needs for evidence-based information. In addition, we work with decision makers to incorporate evidence into policy and practice. And for further information, you can visit CADTH's website or feel free to email me. Skip over the references cited here in today's presentation, and I just wanted to alert you to some additional evidence resources that you may find useful as well that weren't included in today's talk, but they are quite good and comprehensive. Internationally, the Agency for Healthcare Research and Quality in the United States has done a great deal of review work on different interventions in pressure ulcer treatment and management and prevention. As well, the National Institute for Clinical Excellence in the United Kingdom has done quite a bit of work and produced guidance documents on pressure ulcers, as well as this algorithm for risk assessment, prevention, and management of pressure ulcer in adults. So CADTH is on social media, and there are different ways to connect with the organization. As a publicly funded organization, CADTH is here to support and serve the healthcare systems of Canada, and all of our services are free of charge to publicly funded healthcare systems across the country. And Newfoundland and Labrador is a full member of CADTH, so that means that people who work in the health authorities in this province, as well as the Department of Health and Community Services, can submit requests for evidence reviews to the organization, and you can do so through me, certainly, as well as through our website at requests@cadth.ca.